This is an analysis of the community of East Tampa presented by Shamika, Ghani, and Pamela. The presentation will provide a brief historical overview of East Tampa and analyzes its structure, population, health-related resources, environment, government and public policy, priority needs, and global and community issues.
East Tampa is a district within the city of Tampa and is bounded by Eastboro Avenue to the north, 15th Street to the west, Interstate 4 to the south, and 40th Street to the east. The incorporation of East Tampa begins in 1911, and at the time the southwest portion of the East Tampa was merged into the city of Tampa. In 1923, another portion of the community comprising Martin Luther King Jr. Boulevard, part of Eastboro Avenue, were incorporated into the city of Tampa. In 1953, the remainder of the East Tampa community became part of the city of Tampa. In essence, East Tampa has been in existence for 50 years. East Tampa is reported to be the location of several riots. Today, East Tampa has exciting nightlife and has state's best attractions, including Busch Gardens, Lowry Park Zoo, and Tampa Museum of Arts.
The structure of the East Tampa community consists of single-family homes and subsidized housing. The City of Tampa provides services such as Section 8 housing to meet the needs of lower-income families. Many of the homes seen during the windshield survey were occupied and some were unoccupied and unkept, which can pose a threat to safety in the community. East Tampa has several major supermarkets and 2 Walgreens pharmacies located on the outskirts of the community, which provides pharmaceutical needs and nutritional and fresh foods. If you are not fortunate enough to have access to a bus line or a car, you have to rely on the mom and pop stores that are within walking distance for your needs. There are many churches in the East Tampa community, ranging from big to small, that provide the community with support. Brown's Memorial, for instance, has a women's ministry, nurses units, and do yearly health fairs. The Heartline, Uber, and United Cab Company are a means of transportation for residents who can financially afford it. Emergencies within the community depend on the Tampa Police Department and the Tampa Fire Rescue, which are both centrally located within the community. They also provide the community with education on prevention and protection. The Tampa Family Health Centers are available to residents as a one-stop shop for their medical needs. When speaking with a community member, she expressed the same concerns about the lack of access to nutritional foods when you don't have means for transportation. There are approximately 17,000 people that live in the East Tampa community. Residents are predominantly African American and 26% are Caucasian. This is a low-income community with only 45% of the residents employed. The leading cause of death in this community is heart disease. This could be in direct relation to the lack of access to nutritional foods.
There are several health-related facilities located within and on the outskirts that provide service to low-income residents of the East Tampa community. It includes a public health department, health center, a long-term and assisted care facility, and a mental health care facility. There is also the WIC program, which is located within the community, and although it is income-based for eligibility, provides nutritious food to pregnant mothers, women, and children under the age of 5. This provides great acceptability considering 3.3% of the population of East Tampa is under the age of 5. The Public Health Department specifically offers free care and preventative treatments to low-income residents. This is also located within the community. However, access is limited related to the hours of operation and no availability on weekends. It is also not equipped to support the community with acute and emergency care. The privately owned health centers, which offers a variety of services, allows for better access with extended daily hours, weekend availability, and a walk-in clinic. Affordability for the health center is challenging at times, considering that insurance is the usual type of payment, and the community has many uninsured residents. Discount payment is also available, but only upon prior approval. Access to acute care and emergency service is also located on the outside of the community. However, per the fire department personnel, they have an 8-minute response time for emergencies. The 3 Healthy People 2020 objectives that are chosen for the community of East Tampa are 1. AHS-6, Access to health services. The people living in poverty generally have several challenges to access healthcare services. They are confronted with the problem of not having medical insurance to the inability to acquire appropriate services. The health department and the health clinics are not equipped to care for the population with chronic conditions. The city can use this initiative to develop programs that will decrease the disparity and aim to provide insurance to the residents. 2. HP 2020, Social Determinants of Health. As previously mentioned, poor access to healthy food will eventually lead to illness and chronic diseases. This is evident by the high incidence of cardiovascular disease in the community. The city can decrease this disparity by promoting businesses that offer healthier food choices and educating the residents of the correlation of proper food choice and good health. 3. FP3. Increase the proportion of publicly funded family planning clinics that offer the full range of FDA-approved methods of contraception, including emergency contraception. A significant number of teenagers experience unplanned pregnancy in the East Tampa community. An unplanned pregnancy has negative implications for teenagers and the unborn child. A pregnant teenager may be unable to complete school, lack employment skills, resulted in being and eventually dependent on public assistance, which could initiate the cycle of poverty.
While doing the windshield survey, we observed trash cans next to the homes that are provided by the City of Tampa for curbside garbage pickup and recycling. Although the ability to use the trash cans are there still was a lot of litter along the streets and even in some yards. Majority of the roads in this community are in need of maintenance. Most roads were uneven with loose gravel and potholes. According to one resident in the community, her concern is that there are no speed bumps throughout the neighborhood and cars drive at a speed that is fast, and her grandchildren cannot play in the front yard. East Tampa provides the children of the community with recreational and social needs. There is the Jackson Heights Youth Center, Belmont Heights Baseball Complex, and a Boys and Girls Club. Unfortunately, the Boys and Girls Club closed down a week after we did our windshield survey.
The governing official for the city of East Tampa include a mayor and a city council representative. The leaders can be reached by email or by phone with a promise of response within 24 hours. The city's community meeting is made available on the City of Tampa television home, where the meeting is streamed live around the clock, or on the internet, where it can be retrieved from the archives. These public meetings are well attended by the residents. There are no areas of concern noted within the government and public policy. The city has made available to the public its current and previous budget, with explanation of the increase of $55.7 million for the proposed budget. The current budget has allocated $4.7 million for the construction of a fire station in the new Tampa community. The fiscal year 2017 proposed budget for the City of Tampa focuses on three primary strategic goals. They are 1. Changing Tampa's economic DNA, 2. Continuing to empower and invest in the neighborhoods, and 3. Keeping the streets safe. These goals will be met with the objectives of improving the infrastructure of the city by addressing the issues of affordable housing for first-time home buyers and rehabilitating the existing homes. Also, creating jobs, growing the economy, and providing protection for children by developing safe and enjoyable parks which will enhance the quality of life. There are no areas of concern. The City of Tampa remains structurally and fiscally sound. They have allocated $1.8 million of the budget for major improvements and renovation at various parks and recreation facilities, which will empower the neighborhoods in the East Tampa community.
These are the top 6 priority needs of East Tampa community. Poverty is the top priority needs in this community because people living with poverty suffers from high degree of stress, are less nourished, have less access to health information, and suffers higher risk of illness and disability. The farmers market within the community is dirty, full of flies, and flooded. This market is a source of food contamination and potential foodborne diseases. These community members demand for additional grocery store that will provide healthy food choices. Homelessness rate is high within the community, and it mostly affects women and children. Homelessness leads to increased stress level, severe physical and sexual violence, and an untimely death. And affordable housing, senior citizen housing, and care for the homeless members are needed in this community. Findings from the Winfield survey shows that community members need access to healthy foods, increased physical activity, reduce consumption of alcohol and tobacco, and eat more fruit and vegetables to reduce obesity, coronary artery disease, and cancer. An unsafe neighborhood keeps people inside their homes and promotes obesity. Community members want a collaborative effort between the police and the social service agencies to improve the physical environment and address their safety concerns. Teenage pregnancy rate is high in this community compared to other neighboring communities. Teenage pregnancy is related to negative consequences for the teenager and the unborn child. Accordingly, teenagers need education to prevent academic failure, repeat pregnancies, future unemployment, and instruction to protect the unborn child.
As previously stated, poverty is one of the greatest contributors to poor health globally. In East Tampa, there are several agencies available to provide temporary shelters to the homeless. The Metropolitan Ministry is an agency that provides temporary shelter, transitional housing, food, and clothing. They also support displaced residents to return to a functional status. In comparison to East Tampa, in sub-Saharan Africa, the poverty percentage is astronomical. The lack of resources has been linked to ill health, primarily due to the lack of healthy food choices. The Bourgen Project is a non-profit organization that is working to decrease poverty globally. They are addressing the issue by providing training to farmers and assisting with fertilizers to improve their crops to provide healthier food and also resource. Africa is looking at a multidimensional status to health, where contributors of health will reduce poverty. The community nurse can intervene by educating the residents about the availability of services in and around the community. They could offer community training on how to prepare healthier, low-budget meals to maximize healthier outcomes.